we have Dr. Elizabeth Joseph, one of the senior most pediatric ophthalmologists from Kerala, speaking for conventional patching. And against her will be my senior from BJ Medical, Dr. Prasad Vaimbe, who was trained in Arvind under Dr. Vijay Lakshmi for BYNOCS. So over to you, ma'am.
Good morning, everyone. I'm really honored to be here. I'm especially thanking Dr. Parikshit for inviting me. And I am to discuss about a debate about conventional patching versus BYNOCS for amblyopia. All of us are strabismus surgeons, and we know what amblyopia is and such a the magnitude of patients having amblyopia. So what is BYNOCS? BYNOCS is a new software for binocular vision assessment and therapy. It has got both diagnostic modules and therapeutic modules, and it is now being used for treatment of amblyopia. I don't have to discuss about patching because all of us know what patching is. Let us compare the advantages, disadvantages of both these. Patching is traditional, time tested, simple, cost effective, and it is more effective in children, but adults also it is useful. The main difference between these two is that in patching only one eye is stimulated. You are covering one eye, only the other eye is stimulated. And the one main advantage of patching is that it can be used in very small babies, like a 6-month-old, 7-month-old, less than 1 year, less than 2 years. In those children, patching is definitely superior to BYNOCS. BYNOCS cannot be used in small children. And amblyopia has to be addressed at a younger age. Don't wait for these children to grow and then treat amblyopia. Nowadays, people are aware of strabismus. They come early to us. We get patients at 6 months and 4 months of age with esotropia. Even in infantile esotropia, there may be some fixation disparity. Then there may be an amblyopia which we are not able to diagnose. Then also we give patching. That is the biggest advantage of patching. And what about BYNOCS? BYNOCS is new. It has to stand the test of time. It is expensive. It's equally effective in children and adults, just like patching. The main difference is that it is a dichoptic treatment where both eyes are stimulated. We all know that amblyopia is not a uniocular problem, it is a binocular problem, and we have to treat both eyes together. That is the current concept that we all know. And this requires costly equipment. You have to have the special glasses. As I have already told, the main advantage of patching is that it can be used in younger patients, simple, affordable. But the most important disadvantage is that there is issue of compliance and emotional stress. In BYNOCS, the disadvantage is that the child has to be old enough to play with the computer game. The child and the parents have to be rich enough to buy the system, and the parents should be educated enough to understand the mechanism of the games. That is the main disadvantage. And we all know that amblyopia is difficult to treat. There are so many new methods have come. So we are all for change. When a new method comes, we all go for the change and grab the opportunity. Remember cam stimulator. When I started my training in pediatric ophthalmology, then cam stimulator had come in a big way. And where is cam now? It is gone out. So just like that, this new instrument also has to stand the test of time. And at this point of time, we look for clinical evidence. What is the evidence? Whether this binocular treatment is superior to patching. Actually, I looked at the literature. Many randomized control studies are not available to show that this is superior. There are so many studies available showing that the results are almost equal. But none of the study I could find saying that BYNOCS is superior. See, I looked at the American Academy of Ophthalmology, one latest publication published in October 25, 2022. They have compared dichoptic home treatment of amblyopia, a multicentric randomized clinical trial, and there is a American Academy of Ophthalmology Technology Assessment Committee. They have declared that there is no consistent evidence to support the use of binocular therapy over standard treatment based on the PEDIC randomized control studies. And we showed that no superiority of binocular therapy over conventional therapy. But this binocular therapy has got a high adherence. provided, and so it provides an alternate treatment. That is the American Academy of Ophthalmic Technology Assessment Committee's report. And I looked at the American Academy preferred practice pattern, which was published in 2022. That is the titled Amblyopia Preferred Practice Pattern 2022. And their recommendation, this I'm quoting from their publication, recommendation to first and foremost recommendation in amblyopia treatment is to correct the refractive errors. And most children with moderate amblyopia respond to initial treatment of 2 hours of daily patching or weekend atropine. And this can be increased later to 6 hours if improvement is not good enough. Higher hours of patching is met with bad complaints, they say. If still there is no improvement, revisit the diagnosis, look at a retina, and only then they recommend additional methods like dioptic training. So at this point, I will conclude my talk saying that patching is going to stay. None of us are against science advances, changes that is happening, but patching is going to stay, and patching is the primary line of treatment in strabismic and anisometropic amblyopia. And in children who are not compliant with patching or not improving with patching, go for alternate treatment. Thank you very much.
Thank you, madam. Yeah, you can put it. Madam, can नहीं इसको ही करना एडवांस कैसा ऐसा करना है स्कैन
put in mind, no general or not.
Screws debates and I want to run this thing also. नहीं अभी मत रन करो, पहला ये बायनॉक्स का और बाद में ये रन करना है. ये वीडियो नीचे करके रखेंगे क्या?
ठीक,
अभी जोड़
check the audio.
video copy. The history of AIOS, that's the debates and the scientific deliberations are on the cruise.
मैं समय हूँ.
बंद करो.
ऑन कर दीजिए.
So I think my job is made much easier by Madam Elizabeth Madam, because she has already told about the BYNOCS. So it's actually a new frontier in the management of amblyopia. Now let me clear that I don't have any financial, I don't have any shares or this thing for this product. So before starting, let us go to the basic questions that why do you need newer modalities of treatment for management of amblyopia? Because patching is there since time immemorial. I think the first documented evidence of patching was there in 900 AD. I think one of the I think physicians that time that had there is an evidence that he has started patching in Mesopotamia. But the fact remains that so many new treatments have come itself indicates that it's not the only treatment. There is still scope for improvement. So main thing is patching is a monocular approach, whereas BYNOCS has got a binocular approach. As we all know, as Madam also said, that amblyopia is now recognized as a binocular problem and not a uniocular problem. And so newer treatment modalities aim at treating both eyes together. So what are the shortcomings in monocular approach like patching? Obviously, there is a poor compliance. I know because my kid had amblyopia, so I know how difficult it is to patch. There is a poor compliance. There are always issues of residual amblyopia and recurrence of amblyopia if you abruptly stop patching, if there is no tapering. We cannot treat stereopsis. There are deficits in stereopsis, and obviously it's ineffective in adults. So what is BYNOCS? Just to summarize, it's basically a uniquely designed dioptic software for binocular vision assessment and therapy. It has got diagnostic as well as therapeutic modules, and the therapeutic modules treat the amblyopia. What it requires is, since it's a cloud-based comprehensive software, so what you require is just a desktop or a laptop with a Google Chrome browser and either Google Meet or Teams or Zoom, which is installed in it, and a good internet connectivity. Till few years back, we always used to say that mobile is a luxury, but now everyone, even the shopkeeper has a mobile. So similarly, in near future, I do expect that most of them will have either the laptops or the desktops, and it will be an easy treatment for amblyopia. And one good advantage of BYNOCS is that therapist and patient may not be in the same sitting. He can even remotely administer BYNOCS. Patient has to use anaglyph goggles. They are either red, blue, or red cyan. After doing one-time calibrations, usually you give 30 sessions of 30 minutes per day of BYNOCS. So these are the very interesting games, and take it from me, they are very quite interesting. Kids get glued to that. There are various games, and since it's a binocular treatment, usually they improve also fast. So what are the advantages? Excellent compliance, since the kids are on the computer, they are playing with the games. There is faster improvement in visual acuity. Main thing is restoration of binocular vision. In some of the patients it's good, some of the patients it's part, but yes, there is an improvement in binocular vision, and most importantly, it's effective in an older age group also. And obviously no recurrences. Since it's a cloud-based software, again it's a user-friendly. In fact, I myself used it. It was quite useful during COVID pandemic, in which the patients were not able to come to the clinics, and even from the distance, the therapist, he can administer BYNOCS, and obviously it is quite useful for patching resistant and patching non-compliant amlabs. And one more advantage is the examiner can even remotely monitor the examination as well as the progress of amblyopia also. But there are some limitations of the BYNOCS also. You have to correct the manifest strabismus before giving BYNOCS. In microtrophy also, there is a guarded prognosis that has to be clearly mentioned to the patient. And in presence of eccentric fixation also, there is not much of an improvement. So these are various research papers which I have come across as far as BYNOCS is concerned. In fact, one of the paper, Dr. Elizabeth also mentioned about Dr. Burton Kushner is one of the pioneer in strabismology and amblyopia also. So he has also mentioned it's an alternative treatment. So I agree to you that patching is going to stay, but these are the various new modalities of treatment. And again, I'm repeating my last slide because future belongs to those who believe in change. So to conclude, BYNOCS is an effective and useful treatment for management of amblyopia, and obvious advantages are it has got a binocular approach as compared to uniocular approach in patching, excellent compliance, it restores binocular single vision. That's the one of the important thing. Also effective in older age group, and it's useful in patching resistant and patching non-compliant patients. Can we just run the video? A brief video about BYNOCS, and again stating the importance of new treatments which come with time. Mute. Unmute. whenever any new treatment comes, there are always two reactions from the clinicians. Either one reaction is you always discard it, ये बिल्कुल नहीं चलेगा, ये गलत है. And the second reaction is this is the gold standard, it is going to stay, and that is the only treatment. I think as learned physicians, we should always put all these tests to stringent clinical tests.
उन्हें बदल देता है.
And if it stands the test of time, we should adopt it. Again, importance of time.
मेरा जन्म सृष्टि के निर्माण के साथ हुआ था. मैं पिछले
This used to be a
युगों में
famous
था,
dialogue during
इस
our
युग में हूँ और आने वाले सभी युगों में रहूंगा. और जो समय के साथ बदलते नहीं, समय उन्हें बदल देता है. और आज एक बार फिर समय बदल रहा है. ये बताने से पहले कि आने वाला कल कितना सुनहरा होगा, मैं आपसे 3 जरूरी प्रश्न पूछना चाहता हूं. 1, क्या आप इस करवट लेते युग के साथ खुद को बदलने की हिम्मत रखते हैं? 2, क्या आप हमेशा शिखर पर रहना चाहते हैं? और 3, क्या आप समय के साथ बदलने को तैयार हैं? अगर आपका उत्तर है हां, तो जान लीजिए कि कल की सफलता, आज की जीत और आने वाले कल की कामयाबी के पीछे बस एक ही रणनीति है, और वो है परिवर्तन. परिवर्तन पहले सोच में, फिर अमल में. अगर आप मेरे साथ हैं तो यूं समझिए वक्त आपके साथ है. फिर कल, आज और कल बस आप ही होंगे सफल.
Thank you, kind attention. So I think the take-home message is yes, the patching is going to stay. These are the new treatments. If it stands the test of time, we will adopt it. Thank you.
So basically, this various treatment modalities, they have been compared with patching, that itself qualifies that patching is going to stay. That is the primary line of treatment. However, in resistant cases and those who can afford, we should try these new technologies.
Thank you. And again, on behalf of the AIOS, I would like to thank all of you for participating in the session. I think we just have another 5 minutes more before we'll be back. So please enjoy the cruise. Thank you.